Greetings from Narayana Health. Myself, Dr. Hiremath Sagar, working as pediatric intensivist and consultant pediatrician at Majumdar Shah Medical Center, NHL City, Bangalore. Today, I would like to talk to you about fever in children. So, what is fever? So, fever is basically a body's response to an infection or injury or inflammation. Okay, so it's basically a body's defense mechanism when there is something hurting the body. Now, how do you define fever? So, what is the degree of temperature at which you would say the child has fever? So, in the ideal world, the body's temperature should be measured by rectal thermometer, and if it shows a temperature of more than 30 degrees centigrade or more than 100.4 degree Fahrenheit, then it is said to have that the child is having fever. However, it is not very easy to check the rectal temperature, so we usually do it by taking the axillary temperature, that is, you keep the thermometer in the armpit. Okay, so for that I usually keep it very simple. If the temperature shows 99 degree Fahrenheit or more than 37.5 degree Fahrenheit, then I call it as the child is having fever. So simple words is, if the armpit temperature is above 99 degree Fahrenheit, then the child has fever. Okay. So coming to the next question, what are the causes of fever? So the causes of fever are very multiple. It can range from a simple viral fever to a severe life-threatening disease like meningitis, or a chronic disease like tuberculosis, or even a cancer. So it has got a wide range. But fortunately, most of the children usually have viral fever. It is one of the most common causes of fever in children. The other causes of fever, usually they are long lasting, like more than 1 week or 2 week, 3 week, and they have associated symptoms. So usually parents don't need to worry about the other causes of fever. The most common cause of fever is viral fever. So in case your child has got high grade fever, what should you do? So first thing is, no need to panic. Second thing is, don't overdress them. So I mean to say is, so if your child has fever, you don't need to put blankets and 2 or 3 layers of clothes. Probably better would be to rather underdress them, like, just put a single cotton cloth, no need to cover with sweater and other things. Unless the child is having any chills and rigors, you don't need to put too many clothes. Because if you put too many clothes, the body's heat will be retained, which will further worsen the fever. So you have to just open the clothes, undress him, just put a nice cotton cloth and then do that. Second thing is to well hydrate the child. If whatever the child is able to take, please give him orally water and little more amount of water and liquids to be given to the child. The third thing what you can do is give a simple medicine like paracetamol. Okay, the dosage would have been told is 15 milligrams per kilo per dose, a maximum of 60 mg per kilo per day. I think better would be to follow the advice of your pediatrician and give the correct dosage of paracetamol. Then the next step what you can do to reduce the fever is do tepid sponging. So what is tepid sponging? So here you take a little lukewarm water. So the temperature ideally would be 20 to 30 degrees centigrade, but I would say lukewarm water. No need to take a handkerchief or a small towel and keep it over the forehead. That is never gonna work. So what I would like you to do is take a big towel and dip it in a basin of water which is lukewarm and wipe the whole body from head to toe, both on the front and on the back, including the arms, legs, stomach, back, tummy, everywhere. If you do it for 5 to 10 minutes, usually the temperature will come down and the child will also feel better. Some parents and even I also suggest, in case you are able to take your baby and put him in just make him stand under the tap, that would also be a great mode of reducing the temperature. So to reduce a high grade fever, one is you just need to not overdress, well hydrate, paracetamol and tepid sponging. These are your steps to reduce the temperature. So when you should be worried? If the temperature is above 104 degree Fahrenheit, then I would be probably worried about the child's cause of fever and what will be its effect. That is number one. And second would be the associated symptoms, like if your child is having along with fever any lethargy, drowsiness, that is, he is increasingly sleepy, not at all active, or he has any fast breathing, that is, he is having breathing difficulty, or he is having any severe headache, vomiting, or he is not passing urine for more than 12 hours. So these are the signs and symptoms which I would be very worried. In case your child has fever and he has also got all these symptoms, then I would be very, very worried about your child. Okay, in case any of these are there, you need to consult your pediatrician urgently. The other thing is, the child may have fever, but it is like only 99, 100, 101, and you give paracetamol, it will come down. And usually viral fever take 2 or 3 days for the to go completely. But in case your child continues to have fever for more than 3 to 5 days, despite giving paracetamol and other things, I would suggest that you please consult your pediatrician to know what is the cause of the fever. So this is in brief about the fever. So what is fever, how to manage it, and when you should be worried. Thank you.